At its heart, FHIR uses these things called resources. Basically, think of them as digital building blocks.
Okay.
Each resource represents a key piece of healthcare information. Could be medications, patient demographics, lab results, you name it, even billing info. It's all neatly categorized and standardized.
So instead of every single hospital or clinic having its own system with its own language,
Yeah.
they could all be on the same page, sharing information without a hitch, all thanks to these FHIR resources.
You got it. And because these resources are standardized, it's like having this universal code system. So whether you're seeing a doctor in, say, New York or California, they can instantly access your medical info and actually understand it.
Okay, that makes sense, but I'm guessing there's more to it than just having a bunch of separate resources just kind of floating around, right?
Right.
How do they all connect to paint a complete picture of someone's health?
That's where it gets really interesting. These resources aren't just isolated, they're all interconnected.
Okay.
Let's do this, right? You go to the pharmacy,
Okay.
you're picking up a prescription, pretty straightforward, right?
Yeah. Happens every day.
Behind the scenes, FHIR is hard at work.
Really?
Oh, yeah. Every step of that transaction, from the moment that medication is prescribed to the moment it lands in your hand, it's recorded using something called the Medication Dispense resource.
The Medication Dispense resource. Okay, so it's like a digital paper trail for your prescription.
It's way more detailed than a paper trail. This is like a detective's case file.
Okay.
You've got all the critical details in there, the name of the medication, who the patient is, who the dispensing pharmacist was, date, time, you name it, dosage instructions.
Wow. So nothing's getting missed. It's like a digital fingerprint for that prescription. But this medication dispense thing, it doesn't just exist in a vacuum, right?
You're absolutely right. This is where it gets really cool. It's part of a much bigger interconnected web. Remember those detective novels where every clue leads to another and another?
Yeah.
That's FHIR in action.
Intrigue.
Yeah.
I like it.
The Medication Dispense resource, it's linked to other FHIR resources, each one adding a vital piece to the puzzle. So for instance, you have the medication resource. Think of it like the medication's ID card. It tells you everything about the drug itself, the name, the form it comes in, even the ingredients.
So it's like a whole Wikipedia page, but just for that medication.
Exactly. And of course, you need to know who's getting the medication right.
Right.
That's where the patient resource comes in. It contains all the patient's details, making sure that the right medication is going to the right person.
Okay, that makes sense. So we've got the medication covered, we've got the patient covered. Who else is involved in this data relay race?
Well, you can't forget about the pharmacist who actually hands over the medication. That's where the practitioner resource comes in. And then there's the medication request. Now, this is like the origin story of that medication dispense.
So this is like the digital version of a prescription, like the actual paper that you would hand.
You got it. It tells us who prescribed the medication, why they prescribed it, and any specific instructions. No more trying to decipher messy handwriting.
Right, right.
Which means fewer errors, faster service at the pharmacy.
This is honestly blowing my mind because we've gone from a simple trip to the pharmacy to this whole intricate web of connected data. It's kind of amazing. But I have to ask, why does all this matter? What's the big deal about FHIR?
It's a game changer for patient safety, for care coordination.
Yeah.
Imagine a world where no matter where a patient goes, their entire medical history is right there.
Okay.
They're rushed to the emergency room. Doctors can instantly see their medication history, allergies, no more potentially dangerous situations because of missing information, switching doctors, no more carrying around those stacks of paper records. FHIR ensures a smooth transition of care.
It's like having your medical information, all of it, in one place. And it's accessible to anyone who needs it when they need it. No more repeating tests, no more miscommunication.
Exactly. And it goes beyond just these individual interactions. This kind of seamless data flow has the potential to really transform healthcare on a much larger scale.